And welcome to what is the final show for 2024 here for Breakfast Extra. Ladies and gentlemen, you are welcome because, hey, we've got quite the lineup for you guys today. As you can see, we're all in our Sunday best at best for the final show, and you're welcome. So we're going to be diving into what we have for you today. Nigeria's defining moments is how we'll be starting with 2024 in retrospect. We're going to be exploring the highlights and landmark events in politics, in the judiciary, and also the economy. And also we'll shift gears to unpack the business trends that shaped the year in 2024, the biggest economic lessons of the year with expert insights to prepare you for 2025. And that's not all. I and Judith will be talking entertainment. We're rewinding the clock with Nigerian entertainment. The growth, the glitz, the gaps of 2024, spotlighting the creative minds and stories that kept us talking. And for the sports fans, we've got you covered. Relive the excitement of 2024 in sports, featuring record-breaking events and unforgettable moments that made this year special. And finally, we celebrate the wins and unpack the challenges for the African continent in Focus Africa as we examine the continent's triumphs, the struggles, and the road ahead. From politics to entertainment to sports and Africa's future, we have something for every single person out there. Welcome to Breakfast Extra and welcome to the final show, Judith. Are you excited?
To the final show, Mazino.
Thank you very much.
Yeah.
It's been quite a year. I mean,
yes, it has.
It's also been quite a night. I have to keep remembering that this is Sunday and not Saturday.
Weirdo.
Because I haven't had any sleep at all because it's the final weekend.
Well, we're so glad to have you join us this morning. It's been quite the journey from the inception of the show to be able to bring the show to you live wherever you are. We're so thankful for everyone who's followed the show. And this is the very much last segment for the show for 2024. We look forward to 2025. I'm excited for 2025 and everything that it brings as well. You know what I mean? All green, flourishing for 2025. But 2024 has also been quite the moments, if you reflect on it, whether it's our politics, whether it's moments that shaped our pop culture. Just so much happened in 2024. And today is where we put a nice bow to it.
And pack it in the back of our memories and say, well, we'll be coming from time to time to relive the moments of 2024. But today we're going to be starting specially. We're going to be starting with health. So as we wrap up 2024, we take moments to reflect on the healthcare sector in Nigeria. The year filled with significant milestones, remarkable wins, but also persistent challenges. From groundbreaking medical research and expanded vaccination programs to ongoing battles with brain drain and access to health care for undeserved populations. Now, the story of healthcare in 2024 is a complex but very important one.
All right, and absolutely. And we're going to be joined today to unpack this developments and share insights in this. It's none other than Dr. Alero Roberts. She's an associate professor, at the College of Medicine, University of Lagos. Dr. Alero, another day you join us here on the show, and we are glad that you're here. Welcome aboard. Thank you so much for coming on.
You, Judith, and I did catch that day when I grew about to be an associate producer.
I know, it's a brain thing. It switches professor. I don't know why it does that. I think familiarity, because I normally see associate producer.
Yeah, perhaps.
Yeah, that's why it's my brain. It does that thing. So, Doctor, thank you for being here. And let's just start with, the wins to begin with. In your assessment, what were the most significant achievements in the Nigerian healthcare sector this year?
The financial support system, I would say the new vaccine programs we have for the R21 malaria and Mpox. I think those were major wins. It shows the confidence the international community have in us, in giving us those vaccines for which we could combat those epidemics. Again, we've got the financial support for health and education. We had a lot of support from World Bank. I believe it was a little over $1.5 billion as a financing package to bolster our health and education sectors and provide sustainable power. All this will have a major impact on service delivery in this. And I have to speak about the recognition of healthcare excellence that came to us from NHEA and PSHAN. These are private sector organizations that recognize contribution to the healthcare sector, and in 2024 they had data the word has just jumped out of my head. Major events celebrating contributions to healthcare. Those are significant for us.
Well, what about vaccination drives, particularly for polio and Mpox? We saw that so much this year. It gained traction in many parts of the country. How would you evaluate so far the impact?
It's something we still need to do in the sense that when we're looking at the need for continuous and improved surveillance for the disease outbreaks that we have, expanding immunization programs is crucial. So one of the things I was hoping we would be a little later getting into this, but these are some of the challenges that we're going to face. We are facing and will still continue to face in 2025. And these are the disease outbreaks, which means that we need to have these ongoing sensitization, vaccination, immunization campaigns, and even space awareness for common things like health insurance. Making sure everybody is aware, have strategies to keep us healthy. These are things that really need to continue. And, with the increasing cost of living crisis, you can imagine that inflation and poverty will continue to have its effects on the ability for people to access healthcare.
Let's also talk about challenges, shall we? We talked about the wins, we'll talk about vaccination drive, but also challenges. And can you just highlight a few of them? Because one of the major concerns for us was the brain drain, which we also saw this year, but also the security threats as well, with the kidnapping of the medical students along the Benue Way on their way to a conference, believe I'm wrong, in Jos Plateau State. Your take on that, please.
The team will continue to prove a challenge until we sort that security issue out. We're going to be having problems like this. Now, the major thing that a lot of people probably have to considering is that because of security challenges, of health personnel, the death of health personnel, we're sitting in the country where we call medical deserts, places where you cannot access health care no matter how much money you have. That is actually something that's very scary because there are several things that drive the rural urban migration. Creating medical deserts is simply one more thing to drive rural urban migration. And it means that there's an overburdening the health sector in certain areas of the country, Lagos being one of them, Abuja is another one, of course, Akot, Enugu, places where the burden on the healthcare sector is so much. It even worsens the outcomes for people individually and collectively. That's a major one thing. Forgot the flooding. The flooding displaced over 2 million people, including destruction of healthcare facilities, and of course the increased risk of waterborne diseases, chief of which is cholera. You see this, you are now entering into what I would call a vicious cycle of challenges that we are facing. The deficiencies in the primary healthcare system, the inadequate infrastructure, limited access to essential services, because again of the dearth of health personnel, security, power. I remember about 20 years ago, we had proposed, we had submitted a proposal to create healthcare facilities as hubs, where there'd be solar power, there'd be people, a mini business center, there'd be food, and then people could access primary healthcare services. It never really gained traction. Well, you've talked about the brain drain. That is set to continue, unfortunately, because as fast as people want to go to the high-income countries, the high-income countries are actively poaching health personnel. I dare not show you by email how many job opportunities are being thrown at me in my old age for me to go abroad. It's just that
could you give us
I
an
can't face the
idea,
housework.
however? Could you give us an idea? Because it's a very big issue. It's a very big problem in Nigeria. The president actually, mid-year, came out to tell that they are going to make conditions better for doctors to stay. So I'm wondering, between then and now, has anything changed, whether in terms of policy or in terms of the conditions that the doctors are finding better options for outside the country? Has anything changed since the Medical Association came out to voice their concerns regarding the state of medicine in Nigeria?
Changed. Policy was completed, incompletely but completed. We increased intake of students of health sciences in the university, especially the University of Lagos. But this has happened in the absence of infrastructure, logistics, and and I can't say that there is any financial reward for the extra work that we have done, and that's because true. Hopefully, in the new year, we will continue to see these changes because it's very difficult, like somebody would say, you cannot undo 30, 35 years of roads overnight. It takes time. I accept that. And I just pray that the policy having been formulated, it will now be implemented, monitored, evaluated, and improved and strengthened as we go on into 2025 and beyond.
Now, Doctor, I have to talk about something that I feel like needs to be part of this conversation. And it's, first of all, the funding of our healthcare system, right? It's still somewhat below the recommendation by WHO in terms of healthcare funding. And then also the primary healthcare, not just in Lagos, because we know Lagos is doing particularly well in that sector, but also in other parts of Nigeria, in the northern, southeast, and even south-south. Primary healthcare is still very much a conversation that needs to be had. And also healthcare funding, it's another that needs to be had. Have we had significant progress, or has it been regressive in this last year?
In this last year, we have had significant progress. That is true. We've had significant progress. I'm still trying to sort of process it in the sense that when we talk about healthcare funding is not something where you just pick up a pot of money and throw it in the healthcare sector. There are so many moving parts in the healthcare sector. And then don't forget that funding the healthcare sector to see improvement, in several other sectors as well, impact is on health. Like I teach in the medical school, a lot of the progress that we've seen in the health improvement in other parts of the world are due to strategies that occur outside of health. Clean water and sanitation, proper housing, transportation, power, security, all this is outside of the health sector. If it is all properly funded, people can take an active role in their health promotion and, health disease prevention. That doesn't really rely on health. When we need funding in the healthcare sector, you have to first fund the three things. You have to fund the materials, you have to fund the manpower, and you have to fund the infrastructure. These are things that need to be funded properly. Now, I from a very no man's point of view, because in the area of healthcare funding, we don't tend to be a health economist by any means. I'm just the end user in this way. It's like, the processes that we have to go through in order to access this funding can be so wearisome that, for healthcare professionals to leave what they are doing and now enter into the procedural bureaucracy of accessing funding, something is going to suffer. And this is what always happens. We have medical directors of hospitals and federal medical sectors who are practitioners. They've got their own patients to see, clinics to run, surgeries and what. You now want them to leave all that and come into the bureaucratic process of writing letters and going to see somebody and accessing the funds. It's too much. So we need to strengthen those processes or decentralize them, whatever it is going to take, for funding to actually be meaningful to the health sector. I recall on a incident, we took the students out for community health practice and whatnot. And we were there when the state was these SIA, supplementary immunization activities. So we were standing in the PhD waiting to be taken around and so on and so forth, and I heard a conversation. It was very loud, needless to say, and almost getting contentious, where the people supposed to go out the metal SIA on the activity did not expect money to fund transport. And in fact, came to us as College of Medicine whether we could lend them our bus, which we had rented for hire from site. So, you know, you've got a little like that becoming a major impediment to the success of an supplemental immunization activity that has been funded by an international organization. How will an international organization understand that simple things like power, how the people supposed to be out of the supplemental immunization activity had been unable to charge their phones the night before? Phones were dead, they couldn't be reached. Others have came by their own means, and certainly were not going to spend their money to now take transport into the community where they were supposed to conduct activity. So you've got, you've got external international funding, but a little thing like this can now derail an entire. Next thing we'll hear, we were not successful at what we did, so the next time they're not going to give us funding. I'm relating a minor incident in a minor place, but escalate this around the country, and you can understand why healthcare funding and financing is a very tricky issue, and one that we really need the experts to look at in detail going into 2025.
Right. I mean, Dr.
Alero, we have a bit of technicalities here, and we're hoping that perhaps maybe if you were to not use your headphones and speak and microphone, we could hear you better. We're hoping that that would solve the issue. Perhaps maybe we could do away with that.
Sure.
Would that be possible? Yes. Judith, please go ahead.
Yeah, Doctor, we just need you to speak up a bit so we can hear you. Just say anything, so we can test the audio. All right. So just to keep up moving, I wanted to talk about something that also happened in 2024, and it was a public health threat of the monkeypox, the Mpox. It was a public health threat not only for Africa, but also some European countries had the issue of Mpox, and then with the introduction of vaccines, and but it posed a conversation of public health preparedness. Now I know COVID-19 amped public health preparedness for for African continent and for for the world in particular. But do you think that we have regressed in public health preparedness with the way Mpox and cholera and the other small public health threats that we had for this year played out in the public eye?
Fall on that, in the sense that once you don't have healthcare personnel, you don't have a health sector. That's just it. And once you don't have the infrastructure, you don't have the materials, you don't have the manpower, and you certainly don't have the money, you don't have a health sector. So, I mean, what has happened is that the outbreaks really showed us the weaknesses in our health sector line. And, it's all round. Because I was reading a recent document from the Lancet Nigeria Commission, which even our health minister, our NCDC directors, everybody has contributed to. If you look at the authorship of that paper, it's even high-powered, some of the strongest voices in healthcare globally and in Nigeria. And it basically boils down to the fact that, as far as they see it, public health preparedness and strengthening the health sector requires a whole government, whole country strategy. That is, everybody in government, everybody in the country is committed to the same goal, health for all. And we're doing this both individually and collectively. But it means that we have to address many of the issues that we have that concern our weak health system governance. The health system, policy implementation is so poor, monitoring and evaluation which is so poor. Poor surveillance. And a lot of this is poor because of the lack of personnel.
So it's like a problem that comes back to bite itself in its tail, is what you're saying. But let me also ask about this issue, which we have in Nigeria, and many have said that it is what causes our health system to deteriorate, where political office holders actually feel it fit to go outside of Nigeria for their own medical needs. That's medical tourism, but not for all, just for the special few, like Animal Farm, where one animal is better than the, or equal but better than the other in some way or form. What could happen in 2025 to better the situation? How could we make, perhaps maybe political office holders, make sure that they use these these health systems that we have here to be able to make our health system better?
Like this, there's a very dear man in my life, my husband. He always says, turkeys never wait for Christmas. The people who are going to make the policy change to say civil servants or anybody in political office should not go abroad for health or education have to be ready to stay back themselves for both health and education for themselves and their families. Do you think that is ever going to happen?
Wow.
Dr. Alero, you have put quite the insight on today's discussion, and we want to say thank you. You've always come in and give us very sublime takes, and today is no different. Now, what a way to end this year on our very final show for this year with you. Many thanks for taking out the time this morning to join us.
Thank you indeed. Now, do stay tuned, because that's not all we have for today. We're going to be coming back with some very interesting discussion here as we reel out what 2024 was as we prepare for our very next show, which will be in 2025. Let's take a break, and when we come back, more discussions.